Today on COVID-19 Local Impact, the city of Peterborough extends the closure of recreational facilities.
We just decided we're going to extend it out. It might get extended out further than that.
The Rotary Club steps up for the community.
This mask follows their prototype.
And the first COVID-19 related death in Peterborough. Hello and welcome to COVID-19 Local Impact. I'm Dan Malta from the Your TV Peterborough studios. The Peterborough Public Health Unit announced a man in his late 60s passed away at Peterborough Regional Health Centre on Sunday, April 12th, due to complications from COVID-19. The deceased acquired COVID-19 through travel exposure and represents the area's first death related to the COVID-19 pandemic. Medical Officer of Health Dr. Rosanna Salvatera had this to say. Losing a loved one is among the most tragic things anyone can experience, and our thoughts go out to this resident's family and friends at this difficult time. The next update from Dr. Salvatera will be on Wednesday, and we'll have the coverage of the briefing right here on Your TV. We'll now take a look at the updated numbers from the region. In Peterborough City and County, Hiawatha and Curve Lake First Nations, as of yesterday at 4:29 p.m., confirmed positive cases 52 with 968 confirmed negative. Currently under investigation 283 with 1 confirmed death and 20 resolved cases. In the city of Kawartha Lakes, as of today at 11:05 a.m., 108 confirmed cases with 5 hospitalizations and 33 confirmed deaths as part of that 1 confirmed outbreak, 29 of those losses. And in Northumberland County, as of today at 11:05 a.m., 14 confirmed cases with 1 hospitalization and 0 confirmed deaths, as well as 0 confirmed outbreaks. The city of Peterborough made the decision to keep sports fields closed until May 31st. But city staff is open to ideas about creating opportunities for citizens to keep fit while staying safe. Mayor Diane Tarian addresses the decision.
So that decision was made, in light of everything that, has been going on in terms of working with our local health unit, again, taking direction from senior levels of government, as well as the short, medium, and then long-term planning that needs to go along with a lot of those facilities. So, mid-May is when a lot of the summer sports start up, and we know that unfortunately that they're able to run, it won't be at that time. And so we thought just for, to have some certainty for not just the staffing, but also the user groups, we would have that date, which we're getting hints from, again, like the federal levels of government, the provincial levels of government, that likely, we're going to see the extension of some of the, closures at those levels as well. So we just thought it's better to be, play it safe, get it out there that those facilities will remain closed for the, the next, now I guess that's still another 6+ weeks. And then we'll be able to communicate during that time about what the plans are for if and when we're able to reopen in June. And we're not sure. This is the hard part, is that nobody knows. We've had data coming in from, provincial and federal medical officers of health. And, here in Peterborough, unfortunately, we had a death over the weekend from COVID. So while the cases are generally remaining steady or decreasing, we know that this is the time that we still need to be heeding the advice to stay home to slow and stop the spread. Otherwise, we're going to be back where we are now in another 2 months. So as unfortunate as it is, we just decided we're going to extend it out. It might get extended out further than that. But again, we just kind of have to wait and see.
Has the city given any thought to shutting down some lanes of traffic and opening them up as bike lanes?
That's a good question. And I know some other municipalities have talked about that with the decrease in vehicular traffic, more people working from home and limiting their outings, which is all good news that people are doing that. We haven't really had a discussion about that, although that's certainly something I would be happy to bring forward. I think, Peterborough is interesting in that we don't necessarily have as many, wide streets. Some places like Ottawa or Kingston, they have more 4-lane roads. So it's less of an impediment to close the right lane. but here it could potentially be done on some of the areas downtown. And it's great that we're seeing more folks out and about on bikes, walking, keeping distance. Again, if you getting out, that's great, but stay away from people. We'll see as the weather gets nicer and creative ways of, giving people more space.
Many people in our community are wondering how they can help during the pandemic. The Peterborough Regional Health Center put out the call last week for 1,000 masks. Since then, groups have stepped forward, donating personal protective equipment for both healthcare workers and the public. The Rotary Club of Peterborough is doing its part to help by sewing masks for the public's use.
We have, as of today, I think 42 persons have already volunteering. That's a mix of Rotarians and Rotarians' friends, and they have different tasks. Some are driving, logistics. So they pick up material from your house, take it to somebody who cuts, and then we eventually take it to people sewing. We will collect all of that material, sewn, prepared masks, and then their first distributions and intended to go to our hospital. So it's a mask that's intended not for healthcare workers per se, but for the community, for their individual person's use. We're probably approaching 300 masks, and that will be our first offering to the Peterborough Regional Health Center. This mask follows their prototype for, so somebody that's visiting the hospital that has to visit, it's an individual person's use. There are other obligated sectors in our community that have persons visiting or using their services. So city transit, for example, or it could be an emergency shelter, a retirement home. So persons either having to visit, have to make a delivery or something.
If anyone requires any of your masks, is there a contact person?
So Marie can be reached at 705-977-2272. We are also looking for anybody that would be interested in helping either cut material or sew. So persons are saying, how can we help? And in the spirit of Rotary, if somebody wants to help and we can involve them, we'd love to involve them. Our club will remain committed to this project till as long as this community needs masks.
The Cobourg Police Service is advising business owners to protect their commercial businesses. The province has announced all non-essential businesses will remain closed until April 23rd. Your TV's Mark Rockburn gets some crime prevention tips for businesses from Cobourg Police Chief Paul Vandegraff.
This is a tough time for everybody, and first off, for those business owners, this is obviously a critical time for them, and obviously our sympathies and hearts go out to them as they struggle through this. But most importantly, it's although the stores are closed, let's not let them be vacant. So we need to make sure that as owners of these businesses, that we're going into the business once in a while, we're checking it out, we're checking out our lights, we're checking out our alarm systems, we're doing all of those necessary tests. We want to make sure that there's anything really valuable in the store that doesn't need to be there. Maybe it's the time to relocate that to a more secure facility, a security box or something to that effect. Make sure that we're removing those valuables from storefront windows and displays. People aren't window shopping right now. So again, it's about repositioning those valuable items, removing floats, removing cash. There's all those reasons that those things don't necessarily need to be into the businesses. But first and foremost, make sure your lights are working, make sure your alarms are working, and make sure that although the business isn't open, you're still doing your daily checks.
Would you recommend that businesses keep some lights on inside, even though it's a time that many people know that they're not there?
Yeah, you know what? Lights on or in or out, it's always so it's one of those things that we speak about when we talk about crime prevention through environmental design. Too much lighting can be often bad, but yeah, making sure that the outside lights are on, that's really important. So if people are in the back or behind the stores or in the front of the stores with good lighting, that'll just keep people moving around. And then I want to reinforce that we do have our teams out doing patrols and trying to keep very vigilant in the downtown area here in Cobourg.
Sticking with just a tip one more time, Paul. Change your habits maybe of when you go to the store to visit it. Go to different times of the day to keep people, just to keep that. You never know when someone might be inside the store just checking on it.
Yeah, and there's all sorts of ways to check on your store and not be at the store, right? There's lots of technology. Here we stand today doing an interview via Zoom, and there's all sorts of products. You can buy Nests and different Google products or different products. And yeah, incorporate that. So even throughout the day, you can just grab it on your phone or grab it on your computer and just see what's happening outside your business. But yeah, obviously, patterns are bad, and patterns are something that we need to be cautious of.
Is policing different now than it was a month ago, or is it?
Well, we are absolutely in uncharted waters, aren't we? I don't know that policing will ever be the same. I think what we're realizing quite quickly now is this pandemic that we're facing right now. All the information I have is that we're going to see this again next winter. COVID-20, I guess it'll be, or whatever it'll call it. So our policing, our officers, in my opinion, are still very engaged with the community. But some of those really proactive things we can't do. So the crime prevention through environmental design audits that are being done, we can't do those currently. The fingerprint, the child care, the child print, the car seat clinics. The biggest impact is we lost all of that public relations piece and all of that good crime prevention piece. And when you lose the crime prevention piece, you will have an increase in crime. And that increase in crime will be seen, like the wave is coming. So we will have to figure out how we're going to do that. And you're going to be seeing Zoom, probably some Zoom stuff for kids, and our new communications person is now going to be busy trying to put together some really good public safety messaging that we can do via Zoom for kids, and maybe have opportunities for that kind of thing. We're talking about a virtual car seat clinic where we can do virtual car seat inspections.
The main focus of the employment conversation during the COVID-19 pandemic has been around the stress of losing jobs. But what about the stress of essential employees? Our Chris Potter speaks with Lance Anderson from mykawartha.com and Peterborough This Week about how he's managing his role under new circumstances.
Today I'm talking with Lance Anderson. He's over 20 years in journalism prior to all of this pandemic. And we were talking about social media and how incredibly mean and rude and terrible people can be online. And specifically to people that have to manage social media, which Lance does do for the paper that he works for. I can't imagine how difficult that is to deal with, and the stress and everything else, trying to do your job and trying to do that.
Mm-hmm. It's quite challenging. I'm relatively new to the position I'm doing now. I took over online editor duties back in the fall, so I've really kind of been thrown into this feet first, especially now the last few weeks when the crisis hit. I was always one not to follow social media too much. You know, I posted the odd thing socially, you know, on my own. I had a Twitter. Well, I still have my Twitter handle that I still use quite a bit. But this position now as online editors really forced me to monitor, look at these comments that are coming in regularly, and there's a lot, you know, it is disheartening in terms of some of the things you're reading out there. Like you'll make one little mistake on a post and they're all over you. Like you spell something wrong. It's just like, but people don't understand that that's, you know, probably my 30th post that morning kind of thing, right? And you start seeing double, you know, after a few.
So I wonder what challenges are you having in having to have to report on all this horrible news, and how are you dealing with it? What are you doing for yourself to help you get through the day with this?
I think the challenges right now for me is the amount of information that's coming in. Like it's coming at me supersonic. You know, I've got stuff coming at, like it's coming from every angle, right? The province, the federal government, the local governments, all levels of government, plus the people in the community, the health units. So it's like my inbox, my email inbox is just constantly pinging, right? It's nonstop from morning to night.
Outside of some of the the obvious things that we can do, is there anything specific that you are doing for yourself that
I honestly haven't figured it out yet, Chris. I don't know what is working for me. I'm holding it together. It's not like I'm not able to do what I'm doing. I would suggest for everybody, that's probably a really good way to deal with some of this. It's just kind of shutting down for a bit and kind of focus on yourself. And if you're able to go outside and get some fresh air. And you asked me what I kind of do to deal with my thing. And I will. I'll get to a point where it's like I can't do anymore, and I'll just close my laptop and I'll go for a walk, right? And kind of leave everything. And it's funny when you come back, it's all still there, waiting for you to do it. So
is it ever? Yeah.
But it's still good to get out and just kind of, take take stock of what's really important. And I think that's one thing I do is I try to go for a walk as much as possible here. So.
For more from Chris, follow along on his Facebook page, facebook.com/wearetalking. As COVID-19 local impact continues on your TV, you'll hear from Northumberland Paramedic Chief Bill Detler as he explains their updated practices. Welcome back to COVID-19 Local Impact on your TV Peterborough. I'm Dan Malta. During COVID-19, grocery store employees have been declared essential workers. Each day, family members send their loved ones to deal directly with the public. In Coburg, Tony Posmus deals with this scenario on a weekly basis when his son goes to work at No Frills. Tony explains to your TV how their family deals with this.
You have a family member of yours that is currently working the front lines as a grocery store clerk. You could just share those thoughts of your son going out there every day and having to come home and work in those situations.
Yeah, that's I think that's where, honestly, when I talk about us all being afraid, that's one of the things for me, is I know that he goes into No Frills every day, and they do an amazing job there. They're incredible with how they're not only providing support for their staff. I know that all grocery stores are like this. Not only support for their staff, but also how they're managing, physical distancing with the customers, and they're doing an incredible job. But the reality is he's in an environment where there's lots of people around. And so, yeah, there's some fears. We're trying to take as many precautions as we can here at the home. So when he gets home, it's, put your clothes in the laundry right away, take a shower, wash your hands really well, all that kind of thing. And then the other reality, honestly, is just for us, because we're Christ followers and we believe that Jesus cares for us and God's going to take care of us. It's trusting that God will take care of us. And we do everything we can, but then we leave the rest with God.
Has there been any trepidation on yourself or on your son's side about maybe going into work isn't what I should be doing?
I wouldn't say trepidation, and I would say for sure there's been some conversations about whether, what we do with that. And honestly, I think even as a family, we've wrestled with it a little bit in the sense of should he be going in to work, and then also realizing that, if he doesn't, somebody else is going to have to go in. And the reality is we all need food and we all need toilet paper, apparently. We need lots of toilet paper. But, we all need these things. And he has this job that is not only a requirement, but it's actually also an opportunity for him to serve in this way. And so it's, definitely conversations around what we do and if we should, but it needs to be done and he's part of it. And so let's just make the best of it and trust God with everything else.
It is business as usual for Northumberland paramedics. When a call comes in, they respond. Paramedic Chief Bill Detler explains how calls are being responded to during the COVID-19 crisis.
As you know, it's unprecedented times, and the staff safety is our utmost priority, as well as the safety to the community. There's a couple processes that are in place. If someone happens to activate 911, they'll be screened by the dispatcher that they speak with initially. That dispatcher, if that person fails the screening, will notify the crew of such. They'll come prepared with their protective equipment as necessary, depending on the circumstance. So, if it's a suspected COVID-19, then they can expect the paramedic to be in a gown, gloves, goggles, a face shield, and a face mask on.
When the attendant responds and goes to that location, do they also question at that time as well themselves when they're in person for their protection?
Yeah, that's correct. So there is a secondary screening that the paramedics will do on the scene. So that's another thing the community could expect to hear from them.
Talk about the situation now and the frontline staff, such as yourselves that are going, such as your attendants that are going out on a daily basis to protect the residents of Northumberland County.
I can't say enough about the staff. They've all been amazing. They're very prepared for this. Although you can imagine going out into these circumstances that are unknown and unpredictable call environments. Everyone has a little bit of trepidation about that, I'm sure. They've been professional, they're well prepared, they're well educated, they're going to be there for you in the community.
Volume been over this last couple of weeks compared to maybe a month ago?
Surprisingly, or maybe not, if you think about all the circumstances, call volume is relaxed a little bit, and I think it's likely attributed to the fact that people are staying home, that they're not going out and socializing, they're not going to the emergency department if they absolutely don't need to, and those sorts of things. So that has had an effect on our call volume, and it is down a little bit.
Do you respond specifically if it's a COVID-19 case or suspected case when that call comes in? Or what is the discretion, I guess, on the front end when the call comes into the dispatcher?
So every call is the same for us. You call and we go. That's essentially what happens. So if it is screened by the dispatcher or secondarily by the paramedic on scene to be a potential COVID case, then they just prepare themselves appropriately, don the appropriate protection, and make the proper notification to the hospital so that they can be prepared.
What's been the talk from the frontline workers or the paramedics?
Do we have enough public protection or personal protection rather? And there's global shortages. I'm sure you've heard about it all over the globe. So we are okay. We're in a good position, and every day we're getting supply in as needed to keep those people protected.
What do you say to the residents of Northumberland County?
Stay home for us.
That simple?
It's that simple. Yeah, we'll be there for you if you need us, but if you can stay home, please do so.
Premier Doug Ford spoke today addressing plans to extend the Emergency Act in Ontario another 28 days.
Well, good afternoon. Happy Vaisakhi to the Sikh community today. We wish you all the best. I know for many of you, Easter looked a little different this year, but I hope you found ways to connect with family and friends while doing your part to stay at home. I want to say thank you to everyone who worked this long weekend, our heroes on the front lines, in the healthcare sector, in grocery stores and pharmacies, and all other essential services. On behalf of everyone in this province, thank you. I want to recognize our developmental services workers looking after those in group homes. It's heartbreaking to hear stories like what happened at Participation House in Markham. Minister Smith's team has been working around the clock to help. And I know that Minister Calandra has been working directly with the CEO of Markham Stouffville Hospital to address the situation. And I have to thank Dr. Jane Philpott for putting on the scrubs and coming back to the front line. Thank you, Jane. My friends, we all recognize how hard it is to be working on the front lines right now. I know that it takes a tremendous strain on people. But we have to look after the most vulnerable. We have a duty to take care of those who could not look after themselves. We need to stick together. We need to stay the course, and I know it's difficult, but this virus is ruthless and is deadly. Our frontline heroes have our backs, and we must have theirs. And that means giving them the tools they need. This is something I've been laser focused on, and we're making progress in procuring critical medical supplies and equipment to back up our frontline workers. We now have masks, gloves, and ventilators. And over the past 5 days, we've acquired more than 13 million surgical masks, including a shipment of over 7 million masks this morning, 200,000 N95 masks, and 38 ventilators, with much more on the way. And over the past few weeks, we've shipped supplies to more than 650 organizations needing supplies across the province. In fact, this weekend, for every long-term care facility that requested PPE, we acted immediately, and most supplies were delivered within 24 hours. This weekend alone, we delivered over 6.5 million surgical masks to hospitals, long-term care homes, and retirement homes across the province. We're getting thousands of donations every day, thousands of offers to help from grassroots organizations like Conquer COVID-19. from institutions like Queen's Universities, where students and researchers who are working hard to invent and build a low-cost ventilator, from people who just want to do the right thing, like the anonymous donation of 3,500 masks and 20 cases of hand sanitizer dropped off at Minister Clark's constituency office in Brockville. But there's still much more to be done. As Canadians, we need to have each other's backs. And our neighbors in Alberta have committed to ship a generous donation of supplies and equipment. That includes 250,095 masks, 2.5 million procedural masks, 15 million gloves, 87,000 goggles, and 50 ventilators. I want to thank my good friend, Premier Jason Kenney, and the people of Alberta for this generous donation. By standing together, united, by being part of Team Canada, because I've seen what we can do when we come together in the face of adversity. We always answer the call. We're always ready to help. And this pandemic is no exception. Thank you, and God bless the people of Ontario.
That's all for our show today. Tune in tomorrow, same place, same time, 4 p.m. For your TV, I'm Dan Malta, and we'll see you then.